Good morning, ladies and gentlemen, distinguished guests, and the audience present here in the auditorium. This is Dr. Shamshad Rabbani Khan, the graduate of the Field Epidemiology Training Program, Bangladesh. I'm welcoming you all to the opening day of the first Bangladesh Congress on Epidemiology and Public Health, jointly organized by the Field Epidemiology Training Program, Bangladesh, run by Institute of Epidemiology, Disease Control and Research, and the Epidemiological Association of Bangladesh, EPUB. Today, in this introductory session, the guest of honor present among us, Professor Dr. Mirzadi Sabrina Flora, Honorable Additional Director General, Planning and Development, Director General of Health Services, and General Secretary, EPUB, Bangladesh. Professor Dr. Tahmina Shirin, Director, IEDCR, Dr. Michael Fredman, Bangladesh Country Director for the U.S. Center for Disease Control and Prevention, Atlanta. Dear audience, our sincere gratitude to Dr. Carl Reddy, Director TEPHINET, for his recorded message, and Dr. Alden Henderson, epidemiologist and advisor of the US CDC, who also joined remotely from USA. Welcome, Dr. Henderson. We would like to thank all our guests for their precious time. Your presence will definitely inspire all of us to proceed further. Distinguished ladies and gentlemen, the objective of the first Bangladesh Congress of Epidemiology and Public Health are to showcase the public health research and epidemiological approaches to identify the public health priorities in low and middle income countries, to encourage more rigorous scientific assessment and studies to strengthen capacities to respond in public health emergencies, and to increase the visibility of Field Epidemiology Training Program field experiences as well as the work of other public health professionals globally, and to bring to the forefront work, achievements, and research they have conducted on COVID-19. This platform will enable epidemiologists, young researchers, public health professionals, and field epidemiologists from Bangladesh and other countries to share their experiences in the field of public health. Moreover, this conference will provide a unique opportunity for the fellows and graduates of the FETP Bangladesh to share their fieldwork with the national and international public health community. It will also create a global network for public health experts in preventing future pandemics. Dear audience, the event is supported by the Training Program in Epidemiology and Public Health Intervention Network, or TEPHINET, and Center for Disease Control and Prevention, Atlanta, USA, popularly known as US CDC. For this Congress, we received more than 120 abstracts all around the world. The thematic area for our abstract included emerging and re-emerging diseases, disease surveillance and emergency response, COVID-19 pandemic and the role of field epidemiology, non-communicable diseases, immunization, and One Health. We would like to thank all the participants who submitted their abstracts for this event. In these next 2 days, we have oral and poster presentations, plenary sessions, and roundtable discussions. We would like to request all the participants for their active participations in all the sessions. Dear audience, all the posters are open to our website, so if anyone wants to see the posters during the session, they can go to the website and see them by clicking the individual link. Moreover, we have also Facebook and YouTube live streaming going on. So in the website, you can go there and you can find the link to enter to the YouTube and Facebook link. Dear audience, now it's time to listen from our distinguished guests. To begin with, I'd like to start with Dr. Alden, who is a public health epidemiologist and advisor from US CDC. Dr. Alden has been supporting the Field Epidemiology Training Program Bangladesh from the very beginning. With his mentorship and guidance, FETP Bangladesh is successfully moving forward. This is my honor to welcome Dr. Alden Henderson as the first speaker of the Congress. Dear audience, Dr. Alden Henderson.
Just getting us all together, to me, is a success. And for you, for this conference, I have two requests. First of all, to be flexible. Holding the conference on
নো 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 দরকার নেই দরকার নেই এইটা চালাবে
Thank you, Alden, for your nice and short speech. Definitely, your wish and all your guidance will lead the FETP Bangladesh to move forward again. So I have Dr. Farzana with me. Dr. Farzana, can you introduce yourself and continue the session?
Thank you, Dr. Rabbani. I'm Dr. Farzana, a graduate from the 4th cohort of Field Epidemiology Training Program, Bangladesh. I'm currently working as a medical officer in IEDCR. Training programs in Epidemiology and Public Health Intervention Network, or TEPHINET, is a global network of 75 field epidemiology training programs working with a mission to strengthen public health systems across the world. TEPHINET has supported the Field Epidemiology Training Program Bangladesh since 2013. Now we'd like to hear from the director of TEPHINET, Dr. Carl Reddy, on this very first Public Health Congress in Bangladesh. He was kind enough to send us a video message. May I kindly request the IT team to play the message for us.
TEPHINET wishes the FETP Bangladesh every success on hosting its first Bangladesh Congress on Epidemiology and Public Health from March 31st to April 1st, 2021. This is indeed a feather in the cap of the FETP Bangladesh, and there is no doubt in my mind that this will become a signature annual event. Since the establishment of the FETP Bangladesh Advanced Level in 2013, roughly 8 years ago, the FETP Bangladesh has dedicated itself to building field epidemiology capacity. This resulted in the establishment of the frontline level a short 3 years later in 2016, and the intermediate level which will start this year. It is worth mentioning that a member of the first cohort was able to lead the frontline. In fact, the praises of the FETP Bangladesh were sung to me many years ago by none other than Steve Ruby and Dorothy Southern of the Pathway to Publishing fame. I hope that rings a bell. TEPHINET is proud of the achievements of the FETP Bangladesh, including the sterling work that fellows and graduates of the advanced and frontline levels did in response to the COVID-19 pandemic. This included the development of guidelines, regular press releases, and IEC guidelines, event-based surveillance, follow-up of passengers coming to Bangladesh, quarantine activities, the investigation of over 6,000 COVID-19 cases and contacts, training over 2,700 healthcare workers on case investigation and contact tracing, amongst others. FETP Bangladesh even won the TEPHINET COVID-19 response video contest. All of this is indeed testimony to the return on investment that funding committed to FET Bangladesh's growth and development has brought. The truth is that FETP Bangladesh is an inspiration for strengthening public health systems and advancing health security in a country beset with many health challenges. And TEPHINET looks forward to strengthening its long-standing partnership with the FETP Bangladesh and wishes it well over the next few days on hosting its first conference. Thank you. Thank you.
We thank Dr. Carl Reddy for his speech. The US CDC works to protect health and fight disease around the globe. It is playing a significant role to build strong capacities and skilled leaders in public health in Bangladesh by running the Field Epidemiology Training Program with IEDCR. Now we request Dr. Michael S. Friedman, Country Director for US CDC in Bangladesh, to deliver his welcome speech for the audience.
Good morning, everyone. You can hear me okay? I want to start with a thank you to our CDC partners, the Epidemiology Association of Bangladesh, IEDCR, DGHS, and to our CDC team of consultants and staff for their support, their efforts, and their collaboration to make this important conference happen. I want to especially thank Professor Flora and Professor Tamina for their leadership in the field of epidemiology and public health. And I also want to especially thank Dr. Masoom and Dr. Zaki for their day-to-day leadership of this event and their tireless efforts to ensure all aspects of this large conference were organized and prepared. Thank you all. I stated that this conference is very important. Why? Why is it so important? First of all, public health needs more attention and a higher priority in Bangladesh. The health of a nation does not develop only through clinical services. That is treatment of disease and is not really what we mean by health. I would argue that the great improvements in Bangladesh, in health improvements in Bangladesh over the past 50 years are mostly due to improvements in public health and social determinants of health. Global primary education, for example, has been the biggest driver of health improvements and reduced infant and child mortality in the world. This is very much. Hello? Can you still hear me?
Yes, sir. Yes, sir.
All right, that was a little bit. Okay, anyway, this is very much likely the case in Bangladesh, but expansion of family planning, immunization services, food security, and safe water all play big roles as well. These are all public health interventions and things that epidemiologists study and care deeply about. Secondly, going forward, public health and epidemiology have lots more to do in Bangladesh and globally. Of course, we have a pandemic to tackle and current and future outbreaks to address, and unfortunately, future pandemics to prepare for. We also have a number of emerging health issues to understand and address. We'll hear today at this conference and tomorrow a few of these things. The biggest to me are mental health, uncontrolled hypertension, air pollution, injuries, and healthier lifestyles. This is a big change from our infectious disease focus, and that change in mindset should begin here at this conference. Epidemiologists are vital to public health, number 3, and we need to recognize them and advocate for their placement throughout all districts and cities in Bangladesh and their career advancement in the health system. You want your future leaders to think like an epidemiologist and public health expert. We need leaders who see things from a population and community perspective and understand the science of epidemiology and public health. The COVID pandemic and the current wave of new cases is a perfect example of this. Proper disease control action first takes proper understanding of both the disease and the behaviors and fears of the people themselves. I will end this by making one last point. Epidemiologists and public health leaders are only as good as their ability to communicate the science, their findings, and their recommendations. The pandemic globally is a great case study on this. Where do you get your opinions and understanding of this pandemic from? Has information been clear, accurate, and trustworthy? Think about this conference as an opportunity to improve each of our communication skills, not just what we say during a presentation, but also what questions are asked and how we answer these questions. So enjoy the next 2 days, and I hope at the end we learn a bit more about the issues Bangladesh faces and the exciting field of epidemiology. Thank you.
Thank you, Dr. Michael. Institute of Epidemiology, Disease Control and Research, or IEDCR, is the institute that is mandated for outbreak response in Bangladesh. And as a result, this institution has played the first and foremost role and continues to play a very significant role in fighting the ongoing pandemic of COVID-19 in Bangladesh. Now we request Professor Dr. Tahmina Shirin, the Director, IEDCR, to deliver the welcome speech for the audience.
Good morning to Dr. Alden, Dr. Reddy, Dr. Michael Friedman, and Professor Dr. Mizadi Sabrina Flora, and all other guests and audience who present online and offline in first Bangladesh Congress of Epidemiology and Public Health, which is jointly organized by FETP B and Epidemiology Association of Bangladesh. Now, this is a critical time in COVID-19 pandemic, and we realize the need for exchange of scientific knowledges and experience even more during these days. I congratulate the organizers for their timely initiatives and tremendous effort to make it happen, and wish that this Congress will be a successful platform for the national and global public health experts during these pandemic days. I hope the epidemiologists, young researchers, and public health professionals from Bangladesh and different parts of the world who are participating in the conference will use this platform to share their knowledge and experience in the field of public health, especially related to preparedness and approaches to fight against the ongoing COVID pandemic. Last but not the least, I strongly suggest everyone home and abroad to strictly follow all the preventive measures for the COVID-19 situation and ensure safety for all others. And I think that you will enjoy these 2 days, and I would like to stop here. Thank you. Thank you all.
Thank you, Madam. Now, as the final speaker of this welcome session, we'd like to request Professor Mizadi Sabrina Flora, ADG DGHS, one of the pioneers confronting COVID-19 pandemic in Bangladesh, who played the vital role as the then director of IEDCR during the emergence of COVID-19 pandemic in Bangladesh, and is continuing to undertake the challenge to fight the pandemic from the DGHS Bangladesh.
Thank you, Dr. Farzana and Dr. Rabbani. All the participants of this very important Congress, the first Congress on Epidemiology and Public Health, along with the speakers of this session, Dr. Allen, Dr. Michael, Professor Tahina Shirin, and also to Dr. Carl Reddy, whose recorded message we heard. I like to start my conversation. It's better to say it's kind of conversation, it's not a speech. Congratulating the team who have organized this important conference, the very first Congress on Epidemiology during this pandemic situation. It's really hard to organize this kind of conferences within this scenario. It's really very, very difficult. And you took that challenge. I like to congratulate you all. Just to say a few words, most of the things are being already told, as Dr. Michael and Dr. Alden also highlighted the importance of these kind of conferences, and also Professor Tahina Shirin elaborated. So I would focus on the importance of epidemiology perceived by the general people or perceived by the policymakers. I think before this pandemic, epidemiology was not that much felt subject by the policymakers, which has become obvious during this pandemic situation. Everybody understands the importance of epidemiology, and with this backdrop, I think this Congress carries additional value. So I have one request to the organizers to compile all the results of this conference, which will be presented here, all the study findings, along with the take-home message for the policymakers, or the evidences which we can take to incorporate in our policy in order to contain or prevent pandemic as well as our endemic diseases. when we worked with this COVID-19 pandemic, we realized the importance of cost-effective approaches. We had a lot of pressures to do a lot of things, but as Epidemiology Institute, IEDCR had to decide on the which is most cost-effective and which is very important for a resource-limited country like Bangladesh and others. And this pandemic actually is not, we all know that, it's not easy to contain. And Bangladesh was successful in containing as well as starting the vaccination program. Unfortunately, for this month, we are observing upsurge of diseases and it's very rapidly growing. So the need of epidemiologists again is very crucial. The involvement of the epidemiologists is very crucial. Whenever we decided to take decision about which diagnostic should be tested, which methods should be used for diagnosis or detection of cases, which treatment should be considered, when the vaccination should be stopped, when vaccination should be, the second dose should be given, everything we depended on the data. And in many areas, our epidemiologists played a significant role in taking this kind of decisions. And also currently, our epidemiology team is working to identify the containment measures, the public health measures, which measures should get more importance, which area should get more importance in containing this upsurge of cases. Again, epidemiologists are important. So I'm kind of trying to show all the participants the importance of epidemiology. And this is not only for the pandemic situation. As Dr. Michael also mentioned about the non-communicable disease, mental health and other issues. And I'm very happy to see the list of the abstracts you have submitted to this in this conference, which covers every area of public health importance and also every area which brings epidemiological significance. It includes not only communicable disease, it includes non-communicable disease. It includes not only the outbreak prone diseases, it also included long-term endemic infectious diseases. It has included other areas of public health which are more important, like environmental issues and others. It included not only COVID, it includes as TB as well as TB. I'm mentioning tuberculosis because it's one of the oldest disease. So newest addition to oldest kind of diseases, every diseases are being will be presented here by the participants, and we'll learn a lot of things about the recent advancement in these areas. This conference would be a kind of hybrid design, what I understood, like it will have physical presence and it includes the Zoom or online opportunity also. Who couldn't attend physically, we try to connect them through this Zoom link. And as well as it will help us in containing the pandemic, or in containing or in preventing or in fulfilling the public health measures to prevent the upsurge of COVID-19. We expected many of important guests as we decided to hold it on these 2 days. At that time, COVID was actually very controlled phase. So, but suddenly, unfortunately, we are having a higher number of cases now. So we had to redesign. We had to minimize the physical presence of our participants. So for that reason, we couldn't invite many of the persons whom we planned to include. I apologize for that because we had to be very selective to minimize the number of participants to be physically present. And I would stop here because I will be with you hopefully for whole 2 days now and then. I'm not sure how long I could be, but I would be happy to take part, and I would be very happy to take part, not only take part, to participate in every discussion if everything goes well. And I would be happy to have conversation with every participant if I get opportunity to have to learn about your ideas, to learn about your innovations, which should help our Director General's office to develop the next plans, to develop next policies. That would be really evidence-based policy. I thank the organizers for inviting me. I am expressing my gratitude on behalf of Director General's Office as well as Epidemiological Association of Bangladesh for taking EPAB in this important conference as co-partner. Although most of the tasks are done mostly by the Field Epidemiology Training Program fellows and the graduates, but our resources from Epidemiological Association also try to take part, try to help you in organizing that workshop, this conference. I would stop here and thank you very much. And I would end my this small speech reiterating what Professor Tahina said. Please follow all the public health measures to prevent the current upsurge of COVID-19 in Bangladesh. Thank you very much. Thank you all.
Thank you very much, Madam. Professor Mirjadi Sabrina Flora, ADG, Planning and Development from the Director General of Health's Office, Bangladesh. Madam, your guidance and inspirational speech will definitely help us all in the way forward. Now, I have a small request to all the audience present here in this venue. Please mute your microphones in the Zoom link, and also please do turn your volume of the devices a little low. Thank you. Now we would conclude our welcome session and move to the next session.